Welcome, everyone, and
Are
thank you
you
for coming.
approaching
I'm Tim Gardner with Chatham Retirement Partners. And again, and over the next 45
Are
minutes,
you
we'll be
approaching
discussing
retirement
some
and
of the
wondering
things
how to
you
handle
need to know
healthcare
about
costs
effectively when it
I'm
comes
Tim
to
Gardner
planning
from
your
Chatham
retirement.
Retirement Partners.
We're going to be covering
In
a lot of
today's video,
information. We'll cover
today.
the three crucial. If nothing else, I hope you understand the three key points of this presentation. The first key point is that you'll pay a monthly penalty if you do not enroll in Medicare on time. A lot of baby boomers do not know if or when they're supposed to enroll in Medicare. There are very clear rules about when you must sign up. The second key point is that if you do not get private insurance to go with Medicare, you'll pay too much in premium and out-of-pocket expenses. The fact that you need private insurance with Medicare surprises many people. Most people think that Medicare covers everything, but no, you need to have private insurance to have prescription drug coverage and coverage for out-of-pocket expenses. I'll show you how that works in a bit. The third key point is if you do not plan for higher healthcare costs in retirement, you could run out of money and not be able to get the care that you need. People are usually happy to go on to Medicare when they turn 65 because it provides some relief against high health insurance premiums. However, you must be prepared to factor higher future healthcare costs into your retirement budget, and the best time to do that is now. Today's presentation will be broken into three different parts. Part one, we'll discuss Medicare. What is it? Who needs to enroll in Medicare and when? And how do you enroll in Medicare? In part two, we'll discuss private insurance that goes with Medicare. To understand the public-private partnership that is Medicare, we'll discuss how much Medicare costs, what it covers, what it doesn't, and how private insurance integrates with Medicare. In the third part, we'll discuss how to plan for higher healthcare costs in retirement. There are two reasons why healthcare expenses will be higher in the future. One is inflation. The other is increased need for healthcare services as we age. One expense that needs to be planned for is long-term care. Some of you may have had experience with a parent or a relative needing help with activities of daily living, such as bathing, dressing, or keeping up with housework and preparing meals. Many people are surprised to find out that Medicare does not cover the cost of these services. Okay, let's get started with the educational session by talking about Medicare enrollment. Who pays for healthcare in the United States today? If you're under 65, your health insurance is usually work-based. If you're still working, your employer probably provides health insurance. If you're retired, you might have a retiree plan, or maybe you recently left your job and have extended your employer coverage at your own expense under COBRA. Perhaps you've purchased your own health insurance policy. After 65, Medicare generally pays first. Your health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. When you incur a healthcare expense, the bill is submitted first to Medicare. After Medicare pays what it will, any other insurance you have may pay some or all of what's left. The only exception is employer group plans that cover 20 or more employees. If you're still working and covered by such a plan, or if you're covered as the spouse under such a plan, your employer plan will pay first. This has implications for enrolling, which we'll see in just a moment. Unless you're covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. If you don't enroll in Medicare on time, the consequences are dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher that penalty is going to be, and that penalty will continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays their share. Finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, your private insurers coordinating with Medicare must take you if you sign up for Medicare during the enrollment period. But if you don't and you go to apply for private insurance later, you may not be able to get that insurance, or you may be charged a higher premium. Okay, let's back up and ask, what is Medicare? It is a national health insurance program for people over 65. President Johnson signed it into law in 1965. The Centers for Medicare and Medicaid Services are administered and enrolled by the Social Security Administration. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the United States continuously for the last 5 years. Some people under 65 may get Medicare if they receive Social Security disability benefits. Discussion today will pertain strictly to the first group of people, those over 65. Medicare is divided into 4 parts. Part A covers part of the costs of hospitalizations. Part B covers costs of medical services such as doctor visits, procedures, and diagnostic tests. Medicare pays the bills for Part A and B. Parts C and D are where private insurance comes in. Part C is an alternative way to get Medicare. When you sign up for a Medicare Advantage plan offered by a private insurer and get all your services under Part A and B, and usually prescription drug coverage through the plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company, offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is prescription drug coverage. It is offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different. You'll want to sign up for Part drug plans because if you go without drug coverage for very long, you'll face a penalty when you finally do have to enroll. This image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. The chart shows drug coverage is optional. Still, it can be dangerous to go without drug coverage, so we recommend that everyone plan to have prescription drug coverage starting from the onset of Medicare. In Step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's essential because Medicare leaves too many gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. Many companies offer Medicare Advantage plans, so if you go this route, shopping for plans and finding one that meets your needs is essential. Again, drug coverage is shown as optional, but I recommend choosing a Medicare Advantage plan that offers prescription drug coverage. Choosing how to take Medicare is a big decision. It needs to be individualized. If you receive Social Security when you turn 65, you will automatically be enrolled in Parts A and B. You may not want Part B if you're working and covered by an employer group plan. In that case, you can decline it. Otherwise, you'll accept Parts A and B, and your coverage will start on the first day of the month that you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, contact the insurance company offering it and sign up for Part C through them. Or, if you're going to stay on the original Medicare and you have a standalone Part D drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to enroll proactively. This while you enroll in Parts A and B. What if you do not receive Social Security when you turn 65? More and more people are delaying the start of Social Security to receive higher benefits. In this case, you'll need to enroll in Medicare proactively during a Medicare enrollment period. There are 3 main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If an employer group plan covers you because you and your spouse are still working, you have a particular enrollment period, which I'll explain briefly. If you miss either of these enrollment periods, you can sign up for Medicare during the general enrollment period. If you receive Social Security when you turn 65, you'll be automatically enrolled in Parts A and B. You may not want Part B if you're working and covered by an employer group plan. You'll accept Medicare Part A and B coverage, and that will start the first day of the month that you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, contact the insurance company offering it and sign up for Part C through them. If you're going to stay with original Medicare and have a standalone Part D prescription drug plan, you'll need to decide which insurance company's plan you'll want to go with, and you'll have to enroll with them proactively. This while enrolling in parts A and B before your 65th birthday would be best. What if you don't receive Social Security when you turn 65? With more and more people continuing to work or delaying Social Security to receive a higher benefit, you'll need to enroll in Medicare proactively during a Medicare enrollment period. Your Medicare coverage will start on the first day of the month that you turn 65. If your birthday happens to be on the first day of the month, everything moves up 1 month. For example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, and April, your coverage will begin on May 1st. Stop scrolling for answers. Set aside some time to talk using the link in the description below. If you found this video helpful, don't forget to like, comment, or subscribe for more retirement planning tips.